That's right, I think so. Hey everybody, Dr. Bulow here, and thanks again for staying connected with me. This is what I like to call my Staying Connected with Dr. Ian Bulow vlog that I do on a regular basis, just interviewing wonderful folks like Linda Taylor, who you'll meet in a moment. But we also have the Staying Connected podcast, so if you are a podcast listener, just look up Staying Connected on your podcasting platform. And I used to forget this, Linda, but I'm going to remember this on the front end now. When you're watching through this, I want you to do just a couple things. Number one, ask questions, whether it's live or later on, ask questions. Linda, I'm sure, will be able to come back, and either herself or myself will be happy to answer your questions. And the other thing as you're watching this is if you find it valuable or interesting, please do share it. Just hit share right now, and or when you find it interesting, just share it. You never know who may be in your circle of influence that may get value out of what we're going to be talking about. So before we get into that, let's just talk to Linda. Linda, say hi to everybody.
Hi, everybody.
That's right. And you have to forgive Linda and everybody watching. My phone has an autofocus, and I gotta turn that off. I keep forgetting to turn that off. So we'll try and remain in a constant position. But Linda, for those that don't know you, please give us a little 30-second intro into who Linda Taylor is.
Okay. Well, I've been an RN for 40 years, but awesome. I became interested in functional medicine, and when I found out I had a elevated TSH, which meant I had a low thyroid, and I did not want to take the Synthroid that made my mother not feel any better, but made her doctor happy, as she described it. And it made me start digging deeper, and I found root cause medicine and started treating some of the root causes, and never did fill the Synthroid prescription and have a very normal TSH now. And having gone through that experience got me very interested in functional medicine, and I decided to enroll in the Functional Medicine Coaching Academy, and hence my certification as a functional medicine certified health coach, so I can bring that kind of root cause treatment to other people and keep them off medications, hopefully, too, that they may or may not need. Yeah,
and I love that term, root cause medicine. When I was in chiropractic college, there was an educator there named Dr. Burns, and he said, you do know that's what DC stands for. He said, a doctor of cause, Now, in reality, it's doctor of chiropractic, but it was, practitioners that are always getting to the cause of the problem as opposed to treating the symptoms, and I think that's a very interesting and very valid approach to healthcare,
Right, and chiropractors are in the toolbox of functional medicine that we refer out to functional or to chiropractors because they treat root causes for some patients.
That's cool. And you have a very specific observation point as a nurse because you're educated in the medical system in terms of pathology and anatomy and physiology and also patient care, but it's usually allopathic care, disease and condition management. And there's probably, I think you could probably appreciate that there's a role for everything, but what was it that you saw that made you say, okay, disease management and sick care have a valid role, but I want to go to the root cause care? Like, was there a defining moment? Was that through your mom or yourself, or what was it that kind of, because not everybody would do that. I mean, you have a low thyroid, but what made you try and change your lifestyle and your health, as opposed to just managing the low thyroid by putting in extra thyroid, so to speak, extra hormones or things like that, What was it? Was there something that you were concerned about or something that you're passionate about? Like, what's the underlying belief system that made you go down that path?
I think, like I said initially, was that my mother just said she didn't feel any better, and her and I have been very genetically following the same paths in life and having the same kinds of conditions in life.
Interesting. Yeah.
And I said, I'm just not a person who can take a pill because a doctor tells me to.
Got it, yeah.
And if it's only to make my blood work look better and I don't feel any better,
gotcha.
That means nothing to me. I wanted to actually feel better.
Yeah.
And I thought there has to be some other way of doing that, and it was pretty exciting when it was funny because my actual blood work that he drew after I did my initial courses of treatment, my TSH was actually 1/100th below normal.
Oh, wow.
And the nurse called me up and said, well, the doctor wants you to have your blood work drawn again because, the synthroid might be too much for you. And we might have to cut it back.
And you weren't even taking it. So for those of you that don't know, let's just talk about that then. Let's talk about the thyroid. What is the role of the thyroid, and why is it that people develop low thyroid levels?
Oh, there's a lot of reasons people develop low thyroid levels, but it has to do with keeping our energy production and our hormones and all balanced. But I think people mostly associate thyroid with energy.
Yeah.
How it works, I've never been like the detailed physiology person. I kind of like bottom line stuff. So I'm not going to be the best person to explain.
That's right.
The thyroid.
But it does.
Specifically.
It drives your metabolism. It drives your energy levels. And I know you got some extra certifications in stress management, and stress is one of those things that can slowly diminish your thyroid, diminish the effectiveness of your thyroid, because with prolonged stress, you've got lower energy levels, lower metabolism, increase in weight gain, all of that kind of stuff. So the thyroid's pretty important.
Yeah, and the stress is actually part of why why just giving Synthroid doesn't necessarily help people, because the Synthroid is T4, but what makes you feel better is the next metabolite, T3.
Got it. Okay.
And you actually make two different forms of T3, and one of the ways that you make the wrong one, the one that doesn't actually help you feel good, is because of stress.
Gotcha.
Or low certain nutritional elements like selenium and zinc and vitamin D, and so you run into all those things. And probably the other big factor is contaminants, and one that I'm currently kind of working with a functional medicine doctor on is called perchlorates, and it's mainly coming through our water supplies is what I'm told. And I need to keep digging into that one because the EPA has recognized it as a cause of low thyroid.
Wow.
But they haven't set up standards for our water supply. California, and I believe it was Nevada, have set up standards and require the water companies to test for it and lower it if need be, because it's such an important factor in health according to those states. But Pennsylvania hasn't met that standard, and this is what I'm just learning on that one.
So we talk about the thyroid a little bit in terms of why it's so incredibly important with our energy levels, our metabolism, our weight management, our hormone balance. We've kind of hit on some of the things that can affect us, some of these carcinogens that we may find, or chemicals in our water supply, or other things. What I'm also very curious about is what you just kind of hit on there, was what can people do about it? So let's say we've been diagnosed with a low thyroid, or along with that comes extra weight gain, chronic fatigue syndrome, maybe some fibromyalgia. Like, our body's just toxic and run down, and if the thyroid is to blame, or it's part of the complex of issues, obviously we can't diagnose and treat things here on the spot, so we need the patient, we need to evaluate all that. But you had mentioned a couple things there that help your thyroid function better. What were some of those things? I'm just curious.
Well, one of them, especially in my family, we later learned through genetic testing of my daughter that we have a faulty gene for one of our detoxification pathways. So that's probably part of why my perchlorate level is so high, because anything that goes through that pathway, I'm going to have more trouble with. Herbicides and pesticides are really nasty for me. They might not be as bad for somebody else who has a properly functioning detox pathway. So for us, it was partly working on things that improve detoxification. And that was one of the big things that we did. And then just the supplemental support that they make thyroid, I'm trying to think what the right name for it is.
That's
and I'm losing it. Thyroid glandular preparations.
Gotcha.
And that just gives you desiccated, cow thyroid hormones. But they take out the thyroxine. They take out the active hormone,
Got
but
it.
it gives you all the other supports
Then your body can
that
then
go
start
into
to-
your
yeah.
thyroid. So now my body gets those things that help our thyroid. And I'll give one little caveat that usually works the opposite direction of what people think. Iodine is very important for thyroid function, and we know that, but supplementing with thyroid function or with iodine early on in the treatment of low thyroid actually seems to make the condition worse.
Wow.
And I'm not sure people exactly know why, but you know, in your quest for healthy supplements, that one's actually one that we avoid during the initial phases
Interesting.
while you try and treat inflammation and stress and other factors that could be contributing to your thyroid. Once you get them under control,
Yeah.
then you can start focusing.
And you know, this conversation kind of, I think, illustrates a pretty important point that a lot of these issues are way more complex than we first see. You know what I mean? We may have fatigue or may have been told we have a low thyroid, but there's a lot of factors. One of my mentors, who is a functional internist, sort of a gentleman there, doctor, said that he told me the thyroid is the canary in the coal mine, right? So the coal miners are going to the mine, and they have the canary in the cage, and if the canary kills over, it wasn't that the canary was a bad canary, but the mine was apparently toxic. And so if the canary dies, you better get out, and you better get out fast, you know, because the air quality is dropping. And his point was saying that if someone has a bad thyroid, it's not necessarily the fault of the thyroid. It's the whole system is either toxic or stressed or malfunctioning, or there may be some genetic predispositions. There's a lot of things that go into that, right? And like you had mentioned, one of the things when we talk about detoxing and inflammation, no matter if it's a thyroid diagnosis or otherwise, there's probably protocols that would benefit everybody. You know, if we're just feeling run down and our body is not doing well, for starters, we could probably drink more water. You know what I mean? We could probably do a handful of things. So maybe that's what we can round out our time together talking about is like, what are some of the most common cross all spectrum beneficial things that the average American can do to kind of reset a little bit. You know what I mean? I know for me personally, I like, obviously I like chiropractic because I like the neurology and the
Yes.
brain being in control is a good way of resetting, you know. But aside from that, just general wellness, I'm a big fan of water fasting intermittently, you know, just to kind of give my gut a break. There's a book called The Complete Guide to Fasting, which kind of goes into the different types of fasting you can do. Not everybody should jump into fasting cold turkey. There's a process to it all, but just as a way of like resetting the digestive system, if you will. But I know you've been doing some research on stress management and the vagus nerve, but are there one or two things that you think would be good for someone? Obviously, in-depth consultation and treatment is advised, but just in general, the average person who's watching that may say, yeah, what's something I can do to just kind of reset myself a little bit, or some next action steps?
Right. Yeah, it's an interesting question, and part of what I do need to say is functional medicine health coaches, we do not diagnose diseases, but you're hitting at the foundation, which any functional medicine doctor should be looking at the base of your health, which they consider to be the stress, the sleep, the movement, the relationships, the stress.
Got it. Okay.
So as a functional medicine health coach, I can help you with all those areas.
Yeah.
And just helping you with all those may...
So what were those pillars again? Because I think those are important. Like that's kind of the resets there. Not that we necessarily know how to implement and reset them yet, but just to be aware. What are those foundational pillars
that
again?
we're looking at our diet and fluid intake,
Sure.
our sleep and rest, our movement, and our stress and relationships.
Love it. Yeah.
And I've chosen to take a focus on stress.
Yeah.
And I just love how God keeps putting opportunities in front of me that like before I went to Functional Medicine Coaching Academy, I probably would have been too scared to start into them. You know, I tended to be the person who wanted sure things in my life. But as soon as I had decided that stress was going to be my niche, I had heard the comment that you can have a perfect diet and still develop diabetes because of stress alone in your life. And I went, wow, you know, and if you're stressing, you're making cortisol instead of making progesterone, which balances your female hormones. And, you know, so that was another issue that I have in my family. And so it's been really important to me to learn how to treat those so my daughter doesn't have to have the same things that I do.
Yeah.
And one of the reasons I believe that is because genes give you a predisposition to an illness, but not like when I was growing up and we first discovered genes and went, wow, we have the answer to everything. You're going to get X or Y. They're finding out there's a area called epigenetics, where epigenetics means you have a predisposition to, but you don't have a sentence to. You can do factors that turn it on and turn it off.
Yeah.
So watching your factors that would turn on, like in my daughter's case, you know, the endometriosis issue. If we can treat her root causes and keep her from stressing that predisposition, then, you know, Lord willing, she won't have those illnesses. And you can turn off genes.
Yeah,
we used to just think you turned them on and now you're done. And now they've proven scientifically you can turn them off.
That's very interesting, yeah.
And, you know, turning off the stress gene is a huge factor in healing those genes.
Yeah.
And even the end of the genes that determine how long, you know, you're kind of going to live, your telomeres, those can be lengthened as well as shortened by what we do. And so you start understanding just how important what you do is. Yeah, and so the stress management has just been a focus, but I'm going to change that statement because I took a lot of stress management courses in my lifetime, especially when I was a young nurse, and I'll tell you what, basically they ended up being stressful to me because I kept going, I just don't seem to be making any progress on this. I seem to be in the same spot where I am when I started stress reduction or stress management.
Yeah.
And now, this is a program, Heidi Hanna was, if you want to call it the brainchild for it, and she has a Synergy on Demand program, and it's called Stress Mastery. And that's because we really feel you can balance your stress.
Yeah.
And she's given me those tools, and so in the last 6 months that I've been taking her courses, getting in on her ground level, she has a 2020 initiative, and in 2020 she wants us to be able to change the focus from stress management to stress mastery.
Yeah.
And how she's going about that is she is training educators to go out and give this message. And I got to be, just last month, in the first class of certified stress educators. And we tended to think of it as a class because it was 2.5 days in San Diego. And then we came back home, but now we have another 8 weeks of calls and interaction and help in implementing some of these strategies. And it's just really exciting to be part of that.
Yeah.
And it's so wonderful to be with somebody who keeps saying, walk the talk.
Yeah.
Walk the talk. You guys need to be working on your stress levels. What are you doing to master yours? And
well, give us just a couple examples of that. What's a tool or two that you found that's been beneficial?
Well, I'll go back to even just the definition. Heidi has a gift for simplifying stress language. Like, you don't care what's going on physiologically necessarily. So see, she kind of talks my language.
That's right, yeah.
And says, let's simply define stress as when demand outweighs energy. And it's like, wow. So now suddenly when I'm feeling stressed, I have 2 things to focus on because of my definition.
Yeah. What's the demand and how can I either reduce demand or... Increase energy.
And yeah, exactly.
Yeah.
See, once you get the definition, you know a lot about stress mastery.
Just the lack of clarity creates stress in our lives in different areas. So just stopping and evaluating the situation, and like you're saying, creating some binary look at it is pretty cool. Pretty cool.
Yeah.
Just reflecting on it. Wait a minute, stop. I mean, there was I had a pretty stressful occasion the other day. I was trying to fly home, and I had missed flights and canceled flights. And one of my mentors, Jim Rohn, he would say, learn to become fascinated in otherwise frustrating situations. You know what I mean? Which is like when you're feeling frustrated, when you're feeling stressed, just stop and try and become fascinated, meaning trying to evaluate the situation. Like, what's going on here? Like, just evaluate. And what you're saying here is you can put things into categories. Like, what's the demand that's on my life right now, and how can I maybe reduce that demand, and then how can I maybe enhance my capacity to deal with it?
And even just stress mastery tells you to, in a sense, do exactly what you said. And there's a nice TED talk that Heidi does on stress mastery. And she says, be curious.
Be curious, yeah.
Because stress needs to be viewed as information.
Yeah.
And energy.
There you go. Information and energy.
So when you're feeling stressed, you want to understand what's going on. Where did those feelings come from? And, you know, like part of how I got into this stress was because my husband had showed symptoms of stress most of his life. He'd say, no, I'm not stressed. I'm okay. And, you know, what he wasn't recognizing was adverse childhood events, which is another whole topic.
Oh, I'm sure. Yeah, I'm sure.
That, you know, things that didn't go well, but lest I get in trouble with his family, we definitely understand where those were coming from, and love and respect everybody. This is not an indictment on his childhood, but just being able to honestly be curious about it, look back, how is that affecting me now?
Another Jim Rohn quote was that things don't just happen, things happen just. You know, you can usually figure out if you dig deep enough what are causal things, you know, going back to the cause.
Yeah.
But I think it's really interesting, Linda, that as we kind of wrap this conversation up, I think correct me if I'm wrong here, but from my perception, what you're basically saying is that, you know, where we are today is a consequence of a million different factors, and a functional health coach is someone that's going to try and evaluate that, help you process all the data, all the known facts, maybe discover some unknown facts, and just try and gain clarity in your current situation holistically, you know what I mean? And then we can plug and play strategies that get to the root cause of some of these issues, you know. But it's hard. It's hard when you're in it, you know, when you're the person that's in the muck, in the suffering, in the stress.
Absolutely.
I think I can see, just from my own experiences as a clinician, I can see where we can endorse and partner with you to say, like, yeah, people do need coaches in life sometimes, you know, if not the majority of the times, but especially when they're struggling, to someone to help kind of look above and below and through their situation and try and help them, get to the causes, you know.
Well, part of why Heidi included me in there is you were describing probably more a functional medicine practitioner as opposed to a coach.
Okay.
But where Heidi loves coaches and why she wants coaches in this Stress Mastery 2020 initiative is because change is only about 20% knowledge.
Interesting.
It takes about 80% focus on implementation.
Yeah.
And that's hard for us. It's hard for us as individuals. We need accountability, we need guidance, we need direction, but you know, as a functional medicine certified health coach, I'm really trying to help you find your path.
That's cool.
Which is going to be different for everybody. So I'm not necessarily coming at you with a prescription. I can tell you, you know, research supports these kinds of implementations. But why we're so different is we're not the allopathic health coach that says, okay, you need to quit smoking, you need to lose weight, you need to do this. I say, let me help you find your path.
Yeah, that's great. I mean,
to better health.
Because that's one of the biggest stressors is just having the confidence to make those decisions sometimes, because they're big decisions. You know what I mean?
Are.
So having a coach, that's really, I'm glad you made that distinction there, is that you're not necessarily giving the diagnosis or the prescription, but really partnering with people to help them, which is like such a big thing, because it's almost like paralysis by overanalysis in today's society. You know what I mean? There's so much out there, there's so much fear, but then on the other hand, there's so many experts and solutions that you go, well, which one? You know what I mean? Or, you know, so having a partner and a coach to kind of help you clarify, help you make decisions, and like you said, hold you accountable, that's pretty cool.
And helping people to trust their own intuition. You know, God gave us a lot of wisdom.
Yeah.
And we just often aren't still enough
to
listen to and know and understand that. So part of this is just learning to be still and hear.
Yeah.
Because as long as you're afraid and feeling threatened, you're not thinking with your clearest mind. So a lot of stress mastery is aimed at 3 different tiers of thinking, and I need to calm the lower 2 for you to be thinking in your best clear human mind. If you feel like you have trouble with clarity and focus, I can almost guarantee you're carrying chronic stress.
Yeah.
And you really need some help identifying that and learning to calm and listen.
That's awesome. Now, Linda, I know that some of this may not be totally clarified here, but if someone wanted to get in touch with you, what I can do is when we close this interview down, I'll put some information in the description of it, you know, your contact information.
Yes.
But any last words that you would say to folks that are watching, any words of encouragement or words of contact, how they can get a hold of you, anything like that?
Well, I'm in the beginning phases, so I believe you would find me under Linda Taylor, FMCHC. Being a functional medicine certified health coach, and I can give you my home phone, which is the 724, or I'll give you my cell, the 724-683-5346 is probably the best way to contact me right now, and things are developing and I'll have more clear information, you know, as I keep moving forward. But it's been exciting. The first person I coached with with the stress mastery technique, actually saw her blood levels of cortisol, which is your stress hormone. They actually came down enough her naturopathic doctor took her off some of her supplements. So that was really cool to not just have her say I felt better, which she did. Yeah. But to
actually have the validation, the actual change in those things.
So I really, like I said, believe in this technique and believe everyone's an individual, and you know, it's trying to find what you need help with.
Yeah.
That's important to me.
That's great. That's great, Linda. I think it's phenomenal. I think there's definitely a lot of people that could use that coaching and assistance and clarity and help. And I'm just glad that we had the opportunity to sit down and kind of share some of that.
Thank you.
It's
been a great opportunity.
Yeah, of course. If you guys have any questions at all, please don't hesitate to contact us, comment on the video, comment on the blog or the audio, however you're connecting with us. Please don't hesitate to reach out. Linda's been gracious enough to give you her contact information. I'll put this in the description of the notes here. And like I said at the beginning of the show, please share it. You never know whose life you may impact. There may be people in your life that you don't know, but they're carrying a large weight and are dealing with some of these issues. So just sharing it is a great action step to help out. Thanks again, Linda.
Thank you.
And thanks, guys, for hanging out with us today. Thanks for staying connected. We'll see you next time. Bye-bye.
Bye-bye.